COVID-19 is known to increase the risk of heart attack and stroke. The reports of stroke and heart attacks in youngsters hit hard by the novel coronavirus are the latest twist in our evolving understanding of the disease it causes. The intense inflammation that occurs throughout the body in severe cases likely contributes to this increased risk. But it's not clear whether SARS-CoV-2, the virus that causes COVID-19, also affects blood vessels directly. A recent study found that heart attacks in people ages 25 to 44 increased compared to the expected number over the first 2 years of the COVID-19 pandemic, a surprising finding without a clear explanation it is. A recent study shows coronavirus patients are mostly experiencing the deadliest type of stroke, known as large vessel occlusions or LVOs. They can obliterate large parts of the brain responsible for movement, speech, and decision making in one blow because they are in the main blood supplying arteries. Many researchers suspect strokes in COVID-19 patients may be a direct consequence of blood problems that are producing clots all over some people's bodies. Clot that forms on vessel walls fly upward. One that started in the calves might migrate to the lungs, causing a blockage called a pulmonary embolism that arrests breathing, which is a known cause of death in COVID-19 patients. Clots in or near the heart might lead to a heart attack, another common cause of death. Anything above that would probably go to the brain, leading to a stroke. Early on, we saw it could impact the vascular system in cases of serious illness, but now we appreciate the long-term consequences of infection. Large follow-up studies are showing that people who have been exposed to COVID have increased risk of developing cardiovascular complications. So, increased risk of heart attacks, strokes, and heart rhythm disturbances. It can also lead to blood clots, especially to organs that receive a lot of blood, such as the brain, heart, and kidney. More youngsters are experiencing strokes, heart ailments, and cancer acceleration in India since the COVID-19 outbreak. Indians are anyway at higher risk of heart attacks, that too at a younger age than the Westerners because of the dietary habits, high incidence and prevalence of diabetes, hypertension, dyslipidemia, genetic factors, increasing prevalence of obesity and sedimentary lifestyles and smoking, etc. People with pre-existing cardiovascular disease are at higher risk of experiencing a more severe COVID infection and also of having a cardiovascular event after getting infected with COVID. But if you're able to control your risk factors such as high blood pressure, diabetes or obesity, your risk goes down. News Desk, Kerala Kaumudy.